Hi people, Healthy Mangoes here again, but this time with a more serious video. Let's talk about what's the solution for uh, if you don't have any cartilage in your knees or your hips. I just came across this stuff, and it's like from videos. People got like a lot of relief. So let's talk about what is bone-on-bone problem. This comes with age, and this cartilage between, for example, this is like a knee joint. You see like these two bones are separated, and there's like you cannot see, but there's like a cartilage or a tissue between these bones, and when this is gone, you're in a hell of a trouble because you cannot walk. The pain is excruciating when the bone like touch together. You get splints and all kind of stuff. So better keep healthy. And why this tissue disappears? Like there are many reasons. Like one could be diet. This tissue doesn't get, because of bad diet. You get a lot of toxins, a lot of nasty food. It's bad for your, it's overall bad for your health, and this starts to degenerate, bone starts to degenerate and stuff like that. Another option is, another reason is like if you have like a accident, and then this joint, I mean this tissue gets inflamed and slowly gets disappears with age. Like the accident really helps, I mean causes this like the tissue to disappear. uh, Another reason could be inflammation or bacteria comes here, or some kind of viruses. For example, I read somebody that brushed teeth too much, or had like a disease of the gums, gingivitis, and the bacteria travels from mouth here to body and can settle here in the knee, and then this joint, I mean cartilage gets inflamed and slowly disappears. So the main the doctors can say, oh, I cannot do, I can give you shots, but it's not gonna help when it's really this bad, when there's no cartilage. And there are like some other, like what they're doing, doctors now, is like putting your, getting your stem cells and injecting them inside of here, and they, but this doesn't help so well. If you check Rich Piana, that I made video before, he's like 45, and he says this problem, bone on bone, and he's like in excruciating pain all the time. He's like even injecting growth hormone between the bones, but it doesn't help. So maybe this can help him if he's gonna watch this video. It's called Prolozone. uh, I just came across this today, and what Prolozone therapy is, it's like a kind of a mixture of ozone, and it's an injection of mixture of ozone and homeopathic medicine. Yeah, many doctors are doing this, even though if it's a homeopathic stuff, but it helps people. It kind of regenerates the joint, this tissue between the uh, bones in your knee and your hips, but it's quite expensive. It's cost like 130 per shot, and it's gonna, here this girl tried here on bodybuilding, um, but she didn't have bone on bone, but she has like damage in your knees. But she said like she got like five knee shots, and she felt better. So after each shot, but it's expensive. For example, this woman, let's check this video. This woman is like old, 80 years old, and has like bone on bone problem, so she can barely walk, and this doctor gave her like this injection of Prolozone. I thought the Prolozone is some kind of like medicine, chemical or something, but it's kind of a natural thing. Let's see this video.
25th, we're here with Norma. And Norma, you were just telling me the story about your knees, what the doctors told you about your knees before you came to see me for Prolozone.
He had taken an x-ray. It was bone against bone. He said, I can't do anything for you. The injections won't do anything for you. He didn't make a suggestion for knee replacement, but I knew that was the next thing on the list.
And how bad was your pain?
Oh, pain was constant.
100% of the time?
I think this woman's telling complete truth because she's like looking straight and then left when she's like accessing her memory. If she would look like left to right, she would like access her real memory and her fake imaginary memory. So she would like mix things up, but she's always looking right, straight or left when she's accessing her memory.
Yes.
Okay, and how many sessions have you had with me now?
I have had 3 injections in each knee.
And what
3 injections, so like that's like $800 altogether.
has happened? Is there any pain left?
There's no pain. Absolutely no pain.
Remember, she was like in excruciating pain, and now she's saying she doesn't have any pain. This is just one of the videos. There are many old people here that benefited from this. I haven't checked it out because I myself have like this knee pain sometimes. I mean, it's not bone on bone, but something is fucking going on in my knees. So I think I will check this. I hope this stuff is available in Europe. So I'm not sure.
The only thing is there's stiffness if I don't put the legs out. It is okay if I keep them out like this and not back under me.
Yeah, so that's the problem. She has to, but this is like, I mean, from for example, from 10 to 0 pain. It's like even from 10 to 1, it's like relief. So it's worth every money. So I think the rich piano, the monster, should try this. This.
Like what? Move your hands
Like
again?
this.
Okay.
If I'm sitting at a table or something like that.
And this is like after 3 years. And the same woman. Yeah, so how many injections does he get? But I don't know.
Longer than that. And people often ask me, what are the effects of Prolozone over the long run? And here is a patient who's going to tell you. What happened to your knees? Didn't they tell you you had bone on bone?
They did for a fact. My knee has had 4 Prolozone injections, and it's almost back to normal.
And this is from bone on bone needing a replacement, right?
Absolutely.
And it's been more than 2 years.
Oh, yes.
Okay, and you want another treatment now.
I do for a fact.
You know, even if you needed a treatment every 3 years to keep from having a joint replacement, that's not so bad, is it?
Oh, it's really remarkable.
But on a certain number, do you get 86
Great.
treatment, 3?
Oh.
So she's like walking here and apparently there's not a lot of pain.
No, you can come back. No, come back.
She just wanted to leave. Said, fuck you, dog. I pay you so much money while you shoot camera with me. While you shoot me. Okay, so that's it. That's this Prolozone. Here is like there was some. It's. I mean this. This woman mentioned this in 2009. So this stuff is available for 7 years. I don't know why it's not more. But this is shot in 2014. So yeah, it was available for many years. Yeah, this is another guy. I mean, I haven't checked. Yeah, this is all from this same doctor, so I don't know how. Yeah, but I believe that that woman wasn't lying. So if you have this degenerative disease that we will all face somehow, but you should check the Prolozone. And I think, and I'm like pretty sure that it has something to do with like infection. So this ozone goes there and just clears this infection, and the ozone is also good for like healing the cavities. When they heal the cavities, when they spray the ozone gas in, they put the ozone gas in the cavity and they feel the top of the filling with a filling, and then it heals. You don't need like drills. So I think this ozone like just kills like this bacteria permanently, and it allows the body to heal. And that's what I'm saying from the start, that we lose this cartilage because there's constant infection, and you get all these kind of infections from root canals, from infection of the mouth, like gums. I mean, the bacteria comes in all the time, and when you get older, the immune system is not so strong. I mean, like right now we are bombarded with heavy metals, and immune system is like just going frantic. Like after a few years, like more toxins, and aging also is like. I mean, someday we have to die. So but you know, that's one of my main concern when I will be get older. What will I do if I will not be able to walk anymore? I mean, what the fuck? I don't want to have like artificial knees and hips. I mean, that's like horrible stuff. I'm like afraid to have that shit when I'm like 60, and then you have to get them replaced every 10 years. So that was it. That was. I'm gonna try to publish more serious videos like this. Check my website. Like I have a lot of good content from alternative medicine. So I think everybody should check my website and read some of the articles that I have there. Thank you very much, and subscribe, please.